All right, 12:30 here Friday afternoon. It's time for our Medical Minute. And today on Medical Minute, we're joined, of course, by Dr. McGee to discuss urinary tract infections and sexually transmitted infections and how common they are and key symptoms that we need to watch for, treatment options, and some simple prevention steps to keep you healthy. Dr. McGee, welcome back to the news desk.
Hey there, how are you today?
I'm good, thank you. It's
Good.
Friday, it's payday, and we've got a nice
Yeah.
day out there. Weather's beautiful, so we're happy about it.
Yes.
Um,
And the
Doc,
Cubs are winning.
Cubs are
The Cubs
winning.
are winning.
I love it.
Yes. Yes.
Okay, to start, Doc, what's the difference between a UTI and an STI?
Such a good question. And I love that you're talking about this because I just ran into this just, seeing patients this
Mm-hmm.
week. And the difference is with a UTI, it's an infection that's caused in the urinary tract. So this includes the bladder, the urethra, and it's usually caused by bacteria entering into that urinary tract. Whereas we look at STIs, that's more of a sexually transmitted infection. So that infection is transmitted primarily through sexual contact. These ones can be bacteria, virus, parasites, and they affect the genital reproductive organs. And they can also affect other body systems. So those ones are a little different.
Okay. How common are UTIs and STIs, and who tends to be the, I guess, most at risk?
Yeah, so the UTIs are more common in women because of the anatomy, but men can still get them, especially if
Mm-hmm.
they have prediabetes or diabetes. So if we start seeing men that are getting UTIs, we'll start checking them for diabetes because that's usually a common thing. STIs, where that's kind of, those are common all ages. All ages. So can happen from
Yeah.
teens to older adults and especially younger adults, and especially those who have new or multiple partners. So the risk includes people who have unprotected sexual activity, those
Mm-hmm.
that have multiple partners, people who have a history of UTIs or STIs are at risk, people who are in pregnancy are at risk, people, like I said, with diabetes or an immune system, they're also at risk. And those that are using, different contraceptives or different spermicides, they're at risk too, because sometimes, they're thinking with the spermicide doesn't kill those type of viruses and bacteria that could make that person at risk for those STDs or
Uh,
STIs.
for
Sorry.
for the older folks, UTI can be pretty dangerous for them, can it?
Absolutely. And it can cause a lot of times it can be mistaken with people think, because an older person is forgetful or say they're just irritable or something has changed. It could be because the UTI has now become septic in that person. And it can cause changes in their memory, changes in their function. It really does affect the neural system. Whenever older adults have that infection, because sometimes that's the last thing they're looking at, unfortunately.
Okay. Early symptoms. What should someone be looking for before they need to get checked?
Such good questions. I love this because, some of these symptoms, basically, they really can be the same for both. So we can see
Hmm.
burning with urination in both of these. We can see frequent urgency to use the restroom. We can see, their bladder is giving them a little bit of problems, and sometimes they're thinking it's their bladder, especially in women, where it actually could be their cervix. So that could also mean an STI. So other things that we look for is pelvic pain or pressure. That can be in both of them. A big one though for STIs is they're getting discharge that they've never gotten, men and women. They're noticing this, and then sometimes that has a foul odor. That's a big, big red flag. Or if they're seeing any bleeding or testicular pain. A big one is testicular pain. Whenever we see that, we more than likely are going to move toward STI with our
Okay.
gentlemen.
Okay.
Yeah.
Um, Are there any other symptoms that people often ignore, or as you said, they kind of mistake it for something else?
Absolutely. So sometimes when when people are getting these symptoms, individuals, they'll get this mild burning or they're urinating, when they're urinating, or they'll get this slight discharge, or they're going to get the pelvic cramps, pressure. Sometimes they see, their odor, there's an odor to their urine or there's
Hmm.
cloudiness. And sometimes they think, "Oh, it's something I ate," or these other things, maybe they'll think the pelvic pressure is cramping, or maybe it's just something else that they'll wave to the side. Sometimes the urination burning in men often ignore that because 'cause they're thinking, "Oh, it's nothing. I'm maybe that beer did it," or, maybe what I drank did that
Hmm.
to me. And then some women, they'll ignore there's sometimes this spotting that comes between their period from month to month. So that's also a big sign. And so is the itching or irritation. A lot of times people will just ignore it and think, oh, it's really nothing and put it off. And then unfortunately, some of these symptoms don't occur at all in some men. If you have a high pain tolerance, you might not even know that this is going on.
Sure. Okay.
Yeah.
How do we diagnose these? Is this a simple blood draw? What are we doing to diagnose it, whether it's a UTI or an STI?
So usually what we do is with UTIs, we'll have them come in and we're going to, whether, if it's either or, we're going to do a urinalysis. So based on their symptoms, if we're moving toward, okay, this looks like UTI to us, this seems like
Hmm.
more of a UTI situation, we'll do a urine culture, a urinalysis, and we'll kind of, treat them for those symptoms. Whereas if it's an STD, usually we're looking at blood work and we're looking at doing a culture. And sometimes we do all of those just to make sure that we don't miss anything. Because we don't want to miss these things because they can lead to further complications for this individual. So, getting tested and getting screened for the STDs, whenever you are feeling those symptoms, is very, very important. And it's optional because we will ask patients, is this something you'd like to do? Most of them want to do it, especially if symptoms. A situation I had was a person had symptoms for 2 months and
Hmm.
knew that something was wrong. And so I'm like, yeah, you got to come in sooner, so that we can definitely find out what's going on because you don't want to go through that much of a time frame, feeling uncomfortable and discomforted and all of that. It's something that can be handled very discreetly.
I mean, the symptoms are so similar, aren't they? I mean, between a
They
UTI and an
are.
STI. I know a story
Absolutely.
where a doctor had diagnosed it as an STI when here all it was a UTI, and it caused a lot of,
Yeah.
I wouldn't say heartache, but it caused some worriness in the
Yeah.
patient's family, essentially, right? Um,
Yeah.
but they're so similar, these symptoms.
Yes, absolutely. And, sometimes, if a person is going too long with those symptoms, right? So, say by the time this person came to me, it had already been 2 months. So, by that time, is it possible they had a UTI with this infection? Absolutely. Um, they can, because the bacteria is just there. And,
Hmm.
it only takes one time to wipe the wrong way, right? So
Hmm.
which is important, wiping front to back. But, it's so, it's so not good for individuals to wait to get treated. And it's so important for them to get their partner treated. If they're feeling like this is, affecting both of them, both get treated. Not It doesn't hurt to get a screening.
Now, can you pass a UTI on to your partner?
In some circumstances, um, you can. It is possible. We can't rule against it because you can pass a yeast infection. So if
Hmm.
your partner has a yeast infection and this individual is, you're still having sexual contact, there, by all means, males can get that yeast infection also. And then if the male isn't treated, he's going to continue to pass it to his significant other and back and forth. I can't tell you how many times I see that.
Yeah.
Many,
Yeah, I
many,
mean,
many
it could just be
times.
bouncing
So,
back and forth, right?
absolutely, absolutely.
Okay. Let's talk about prevention steps. How can people stay safe in everyday life?
So, how to stay safe is basically, you definitely want to, you know, stay hydrated. The biggest thing is, people don't realize this, and it's not something that we have out there saying, hey, this is what you need to do, but they should always urinate after sex, men and women. Always. It's so important. Don't lay there and go to sleep. Get up,
Hmm.
go to the bathroom, because that's
Okay.
actually preventing a UTI. Because and otherwise, for females, it can cause what we call bacteria vaginosis, because their pH is basically intertwined with somebody else's, and the body doesn't like that sometimes, so it's going to fight, back and try to basically, defend itself. So
Gotcha.
it's so important to do that. But also wiping front to back. Like I said, it's so important for women. Avoid irritating products. Avoid, a lot of women, there's still women out there that are, using products to clean with that are just not meant to be cleaning with.
Hmm.
Should never use harsh soaps or, anything like that, because that's not an area it was ever meant to clean. They have to realize it's a sensitive area, and men too, also, use the condoms for the barrier. Always, always, always. If they know they're going to be, baby, I'm with more than one partner, I want to protect myself. It's absolutely still, the best form of preventing an STI. And get screened for STIs frequently, and then communicate openly with their partner about, hey, we should both get screened. This is important. And I thought, years ago, when I first started practicing, a young couple came and they both wanted to get screened. They were in a relationship, and they said, you know what, before we start moving on to our next phase, we want to both get screened because we want to make sure that we are very honest with each other. And I thought that was such a wonderful thing to do, for a couple. So being honest about everything, and, making sure that, you're moving forward together. And the reason I say that is because when women get pregnant, and say this couple wants to move on and have a family, you want to
Hmm.
protect against STIs because they can cause a lot of damage to the newborn child.
Okay. Okay.
Yeah.
Misconceptions. Are there any myths that you're hearing often about some of these infections?
So sometimes, one of the biggest things we'll hear is, well, I'm not sleeping around. Only promiscuous people or people that are sleeping around, they're the ones that get those STIs. Very, very not true. Okay. Absolutely not. Because as we just discussed, people don't know sometimes that they are carrying an STI and they're
Hmm.
not getting any symptoms. So they're not even aware that they have an STI. So doesn't mean that you can't get it. Just by, having a relationship with somebody, and you know what I mean, and sleeping with them, and then boom, could be herpes, it could be other stuff. So so important. Another thing is people say, well, UTIs is because, people have poor hygiene. A
Yeah.
lot of people think urinary tract infections are absolutely false. It does not cause it. Um, like we just talked about, people who maybe after sex they fell asleep. Bam, they get a UTI just because their body is more sensitive to that bacteria. So there's many reasons why they can get a UTI besides poor hygiene. It's absolutely false. The symptoms will go away. I'm fine. And that's something people often say. This is going to go away. It's going to go away. My body's going to fight this. Sometimes it doesn't. So that's another big false one. And all the garlic and everything they try for home remedies, not gonna work. So, and then another one is you can always tell if somebody has one. Actually, this is not true. Like I said, many people have symptoms or they don't have symptoms. They don't necessarily have to have symptoms. So, so important, to wear the condom or make sure that you and your partner are being safe and getting STI checked. Usually it should be honestly a routine thing done yearly. If people want to be safe, or if they have slept with someone and not used a condom, another reason to go and get checked.
Okay. I've got one more for your myths or misconceptions that I don't think I heard you mention. Cranberry
Mhm.
juice.
Oh, yeah. Yeah, exactly. That's another one where they think if they drink enough cranberry juice, that this UTI symptom is going to go away.
Hmm.
Unfortunately, it doesn't. And what happens with the UTI, some of the complications is it moves up the urinary tract system, right, to our two kidneys. And so that's whenever we're looking at pyelonephritis. Now, that's something we don't want our patients to get, which means there's a kidney infection. A lot of people can get very, very sick from UTIs, not being treated properly.
Okay. Let's talk about obviously, if it's getting to your kidneys, that is bad news. But when should someone definitely see a doctor instead of waiting it out?
Okay, so one of the biggest thing that you just mentioned was that kidney, right? So if they're getting pain in their back, in the
Hmm.
middle of their back, that's a big sign to us that there is kidney pain now. We call it flank pain. And that's a big sign. So if they're already feeling that pressure down there and they're feeling everything else, then they drank all their cranberry juice, still not better. Now their back is hurting. Big, big sign. Go to the ER or go see your doctor. Better yet, go to the ER because at that time it might be in the kidneys. So, another thing is if they're feeling fever or chills, that's a big sign to go in. If they're having any blood in their urine, that's another thing that can happen because when the urinary tract becomes so infected and there's inflammation there, blood will start to be produced. And then severe pelvic pain, if they're noticing they also have genital sores or blisters that they've never had before. And they're, painful, another reason to get checked. If they're noticing that they got a discharge that has an odor, go in and get looked at because we need to figure
Hmm.
out what that is. And if these symptoms last more than 2 days, please go in. It's so important. Because, like we talked about, it's so important to stop the complications of these types. Both of them can be very complex. So, also, if they've slept with somebody that's a new partner without a condom, definitely time to get, looked at. Better safe than sorry, is what I'd like to say.
Better safe than sorry, absolutely. And before
Absolutely.
we let you go, what is your best advice for somebody who might be noticing symptoms but isn't sure what they should do?
So one of my people that I seen recently told me, I Googled my symptoms, which is what brought them in to see me.
Mm,
And I
okay.
would say, please, please don't self-diagnose. Please don't,
Yeah.
that's great that they do that. That's great that we have Google and we have all of these other outlets, but it's better to, if they think something's wrong, get checked early and be honest about their sexual history and their symptoms with their provider. There's nothing to be ashamed of. The last thing
Hmm.
you want would be something really bad to happen, right? Where we're looking at, worse symptoms, and then, avoid sex until, you get checked. I would say because if you, like we said, pass it to your partner, it's not going to be good because you're passing it back and forth. And I will say, last thing, please be careful, men that are buying things over the counter or on Amazon for stimulants or anything like that. I've ran into that too, where I've had to have some men go to the ER immediately because some of those things that you're buying online may not be appropriate for you and they may cause really serious side effects. So be careful.
Okay. Wow, that's a lot of information there, Doc, for us to cover. And
Yeah.
hopefully, folks, if they are feeling any of those symptoms, make sure they get in and get it taken care of.
Yes, absolutely. Better safe than sorry, and you know, nothing is there's nothing we haven't heard as providers, trust me. And we
Sure.
want our patients to feel like, what, that's a confidential spot and anything you say is between you and me and we are held by the law to keep it confidential, so no worries.
Okay. Well, Doc, you have a great weekend. Enjoy the weather. Hopefully it's going to be nice there in Chi-Town.
Absolutely. Looking forward to the next Cubs game.
All right. Thanks, Doc. We'll catch up with you in a couple weeks. All right.
All right. Have a great one. All right. Bye.
Bye-bye now. All right, 10 minutes in front of the top of the hour. We'll take a break here on the news desk. We're right back here on KFYR Plus.